Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristen Jackson. Every week, I share my over 25 years experience to guide both men and women as they age. Listen as I discuss a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. It's happening to all of us, so listen for some solid scientific knowledge on how to handle these changes. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. Are you a woman struggling with irritability, depression, physical exhaustion, and weight gain? Are you having hot flashes or difficulty staying asleep? Maybe you're wondering if these symptoms are related to perimenopause. Then today's episode is the one for you to listen to. Today I'm discussing what to expect during the menopausal transition and how to tell if the symptoms you're experiencing are related to it. So let me go into how menopause happens. You can think of your adult life in 3 stages. The reproductive stage is when you're still having your period and still able to get pregnant. Biologically, it means we have plenty of eggs in our ovaries. The second stage is the menopausal transition, and that's really a time of change. Your menstrual cycles are changing, symptoms are emerging, and your fertility is declining. Biologically here, it means that the number of eggs in our ovaries is declining or reaching a critically low level. The final stage is the postmenopausal stage, and this is the time after your period has stopped. Fertility has now ended, and some of your symptoms continue, some get worse, and many additional health risks begin to emerge. The biological change here is that our ovaries have run out of eggs and can no longer produce hormones. So I'm going to focus mostly on the menopausal transition today, that time when the ovaries are reaching the end of their lifespan. And this is truly a stage because the transition from fertility to non-fertility can last between 7 and 12 years. And there's an exceedingly wide variety of symptoms that patients experience during this stage. Every single woman's perimenopausal transition may be unique, and there's no way to know what, if any, particular symptoms one individual woman may experience. Some patients hardly experience any symptoms at all, whereas other women will just have a whole laundry list of things that's going on. The menopause transition starts in our 40s and can last until about the mid-50s. It's definitely abnormal if you enter menopause before age 40, and that condition should be evaluated by your physician. But for the majority of women, they will begin the menopause transition in their 40s. Probably the most striking symptom that patients experience during the menopause transition is a change in your periods. Now, for some lucky women, the periods begin to get shorter and lighter, and the time frame from one period to the next gets longer and longer. Sometimes you'll skip a period for a few months and then it comes back. And the periods will just fade away and they'll stop menstruating. And lucky for them, that's a great way to go through the menopausal transition. But other women will see the opposite happen. Their bleeding begins to get heavier and longer. Sometimes they start having flooding episodes. They can have an extended period of time of bleeding, like 10 days, 12 days, 1 month, 2 months, and then 2 or 3 months with no bleeding at all. And it's completely unpredictable. For these women, it's really important to monitor for iron deficiency anemia because all of that excess bleeding can lead to anemia. And most importantly, no matter what the changes are to your menstrual cycle, it's important to remember that it's still possible to get pregnant during the menopausal transition, even though it becomes more difficult. I remember a wonderful 47-year-old patient of mine. She's a mom of 2, and she was sure she was going through perimenopause. She had hot flashes, she had weight gain, she was skipping her period for months at a time. So she finally came in to see me after about 6 months of not having her period. Not because she was missing her period, but because she woke up one morning and was absolutely terrified because she all of a sudden felt a distinct kick in her belly. And sure enough, she was 6 months pregnant and had no idea. So she and her 50-year-old husband are now completely white in the face when I did an ultrasound for them and told them they were 6 months pregnant. So please do not forget a good contraception option during this time if you are sexually active and you don't want to get pregnant. So, the most well known symptom associated with perimenopause, besides a change in your periods, are hot flashes and night sweats, which together are called vasomotor symptoms. These are a feeling of intense heat that usually begins in the chest and it works its way up the back of your neck. For some women, a hot flash is mild. They just get a feeling of warmth that comes and passes a few seconds later. Other women experience more moderate hot flashes. This is that feeling of warmth also associated with sweating. So the back of your neck may get wet, your hairline may get wet, and then you might feel a chill after the hot flash passes. Some patients actually refer to it as their own internal furnace. And then some women can have severe hot flashes. Severe hot flashes is that same feeling of heat with the sweating, but it is so intense that you actually have to stop what you're doing, take off some clothing, get a fan, leave the meeting, go outside. It's so disturbing to have these severe hot flashes. For some women, if they're happening at night, we call them night sweats. And again, those severe hot flashes at night can cause women to wake up and their pillow is soaking wet, their pajamas are soaking wet, they've got to change clothes before they can go back to sleep. I remember when my mom went through menopause, she had a specific bandana that she carried around with her to constantly sop up the sweat on the back of her neck. And she would not let me help her with any treatment. And it was so difficult to watch her go through these severe hot flashes. So, keeping in the theme of every woman's menopause is unique, some women have no hot flashes. And here, of course, I'm talking about without any hormone replacement therapy, whereas others have these horribly disruptive symptoms. Black women tend to have the worst vasomotor symptoms, where Asian women tend to have the least. So, it may also be related to what race you come from. So, while many people are aware of hot flashes that are associated with the perimenopausal change, there are many other symptoms that are very often not recognized to be associated. And frankly, many times patients are told either that these symptoms are just happening as they age or they just have to deal with them until the menopause transition is complete. Depression, anxiety, and irritability are the perfect example. Many of my perimenopausal patients who have these symptoms and actually seek treatment for it are first given an antidepressant as their first line treatment. So, as women describe being overly emotional and tears are popping up at the least little thing, they may feel like every little thing sets them off and they're snapping at their husband and their kids. And they don't normally feel that way. So, of course, it makes them feel like a bad mom and a bad wife. Other women will describe it as PMS with a vengeance. They're just overly emotional and all the time. So, just as you can experience mood swings when you're first getting started with your period, those horrible mood swings can come back as your periods are finishing up. Plus, the mood swings can be associated with additional physical symptoms such as exhaustion, belly bloating, breast tenderness, headaches. And then there are additional symptoms we see at the time of menopause that we don't really see in young girls starting their periods, like sleep disturbances is a big one there. Even if a woman doesn't have any night sweats, they might have trouble falling asleep or staying asleep. Brain fog is another really universal one. You can feel like your brain is fuzzy, where you can't remember anything as quickly and as easily as before, or you have trouble juggling all the things in your brain that you could once do with no problem. And this brain fog is often occurring at a time when women are reaching a pinnacle in their careers. They're in their 40s and 50s, so they're leaders or managers. And now they're hit with a whole host of physical and emotional symptoms to contend with. They're noticing skin changes due to a loss of collagen. There's an accelerated rate of wrinkles and skin laxity. There's hair changes as well. A low ratio of estrogen to testosterone causes thinning of hair at the crown of your head and widening of your part. Estrogen also protects the growing phase of our hair, which is called anagen. So each hair follicle without estrogen stops growing. Palpitations or heart flutters have been associated with perimenopause, as well as joint pain, especially at the base of your thumb, which means now manual tasks are going to be more difficult to perform. I will tell you, I experienced that, and that affects me in surgery, using my hands and fingers to operate when your thumbs are really sore. So, if you're listening and you're in the right age range between 45 and 55, You might be thinking, oh my gosh, I have some of those symptoms, or I have all of those symptoms. So, how do I really know if my symptoms are related to perimenopause? Well, the first step is to see a qualified menopause provider. And the very honest truth is that many primary care physicians or endocrinologists and even OBGYNs are truly not experts in this area. It may make sense that your OBGYN or endocrinologist is the expert in hormones. That's kind of what their job sounds like. But the perimenopausal change is not well taught in traditional medical school or residencies. So, your physician really needs to have the passion and drive to go beyond traditional medical training and dedicate themselves to learning about the biological changes happening during this time. So, if you're seeing a provider and you feel like your symptoms are being minimized or pushed to the side, or you're being told, yes, that happens as you age, you just have to deal with it, please search out a qualified menopause provider to learn more. Because unfortunately, sometimes you just have to take your health into your own hands and really push to get the treatment that you know you need. And once you're with a provider, they should start with a full history of your symptoms and any other medical conditions that you have. They should take a full menstrual history. So we want to know what the pattern of your periods is and how it might be changing. You should have a complete lab panel looking at your blood count, your kidney function, your liver function, a full thyroid panel, vitamin levels, and hormone levels. And as I always teach people with hormone levels, there's no normal because it's normal for a 60-year-old woman to have an estrogen level of basically zero, but that doesn't mean it's optimal. So if you do get a blood panel, don't worry too much about your absolute results. Your menopause provider should be able to help you understand your levels. While your results may be, quote, normal at your age, they may be contributing to the symptoms that you're feeling. So, putting it all together, your history, your symptoms, your physical exam, and your labs, that's what's going to give you the best picture of what's going on. Because what else could it be if it's not perimenopause? You certainly could be experiencing perimenopause symptoms, but you may also have poor thyroid function that needs to be corrected. Or you may have chronically elevated cortisol levels related to stress. You may have poor sleep patterns as your primary issue. Or you might have an unhealthy GI tract leading to digestion and weight issues. All of these things can be occurring in addition to menopause. But the bottom line is, for most women, treatment of the perimenopausal symptoms is really going to correct a majority of what you're feeling. And then, if there are symptoms left over, then we can address them by looking at them individually. So, if your menopause hormones are optimized and you're still struggling with sleep, we can address that on its own. Or if your menopause hormones are optimized, but you're still feeling fatigue and tiredness, we might address a thyroid issue or a gut issue. So, to sum up, the list of symptoms that occur during the menopause transition is much longer than most patients realize, and also more than many physicians realize. And that's why I really want to empower people to find a menopause provider who is passionate about making this part of their life amazing and make them feeling better, as well as to help them improve their aging as they get older.
Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and will be grateful for your positive review. We'll talk next time.